This is the Whole Care Network. Helping you tell your story one podcast at a time. Content presented in the following podcast is for information purposes only. Views and opinions expressed in this podcast are solely those of the host and guest and may not represent the views and opinions of the Whole Care Network. Always consult with your physician for any medical advice, and always consult with your attorney for any legal advice. And thank you for listening to the Whole Care Network.
This is Sarah, and I just want to take a moment to speak to you about this week's sponsor, Favor. Favor, Inc. is a statewide family-led nonprofit 501c3 organization that is committed to empowering families as advocates and partners in improving educational and health outcomes for our children. Favor is the Connecticut state organization of the Federation of Families for Children's Mental Health. Favor offers a single place for families with children who have medical, mental, emotional, and behavioral health challenges to find information, assistance, and training. To find out more about Favor, please go to favor-ct.org. We are grateful for our opportunity to work with Favor as a sponsor, and now on to the rest of the episode.
This episode is brought to you by CogniView. CogniView provides cognitive assessment tools to a broad range of healthcare providers for the early detection of cognitive impairment. Early detection allows patients to address modifiable risk factors sooner, potentially changing the course of cognitive decline. It also allows healthcare providers to develop a plan with the patient and caregiver so the patient can live their best life during their journey. For more information, go to www.cognivue.com. That's www.cognivue.com.
Hello, everyone, and welcome to Caregiver Chronicles. My name is Sarah, and today I am very excited. I have Isabella Thor with me. Isabella is a nutritional therapist practitioner. She works with women who are suffering from hormonal disorders and couples facing fertility struggles. Today, Isabella is here to talk to us about period pain, what's normal, what's not normal, and menopause and what's normal and not normal. Hello, Isabella. How are you today?
Hello, Sarah. I'm so good, and it's so nice to be here. Thank you for having me.
Thank you. I'm so excited to have you here. First, could you please further introduce yourself to my audience?
Yeah, of course, no problem. Hey, I'm Isabella Thor, and what I do is I run an online private practice, just focus on women's health and or couples with infertility challenges. I take almost anybody really, but the thing I really help a lot of people with is their hormones, their fertility, and finally, there usually comes along with it some sort of weight loss component as well, because of course, it's all connected. If you didn't know that already, let me be the first one to tell you, all of those things are absolutely connected. And I was so excited to meet you because we're going to talk about both of the things that I love talking about, which is how period pain is not supposed to be painful and menopause is not supposed to be crazy. And both of those things are head-turning statements. Let's put it that way. And I love the reaction I get from the young and the old alike when I say it. And it's true. That's what I'm here to tell you, and I'd love to get into it. Whether or not we spend a whole time on one topic or we separate this into 2 episodes, whatever works, it's just important that we get this information out there.
Absolutely. Thank you so much. And I want to just mention for my audience, because they're like, hey, this is a caregiver podcast. Why are you talking about periods and menopause? There's a few reasons why Isabella and I both agree that this is super important for family caregivers. First of all, the majority of family caregivers are still women, and we're suffering. A majority of us are suffering from either period pain or menopause, going through the symptoms, How many men out there, and I know you might be a man, you could have already turned this off. If not, I hope that you listen all the way through. How many dads out there are caring for a teenage daughter with special needs or something
Mm.
like that and doing it independently and need this information? How many husbands out there have wives that they take care of that something happened and their wife needs their care? What's related to their diagnosis? What's normal menopause? What's normal parent? What is all this stuff? They need to know all this in addition. This is so crucial to our health as caregivers and also in so many circumstances the people we care for. So I hope the men stick around for this episode, because especially if they have daughters and wives, I think that this is going to be super awesome. I know a lot of men are super uncomfortable with this topic, but yeah. So
Mm.
why do you think caregivers need this information?
Oh my goodness. I'm so glad you not only spoke to caregivers straight away, but also to men. The like number one response I get from men is like, I'm just so happy I found you, so I was able to tell my wife. It's not supposed to be this way. Look, she says so. Like that's basically all they had to do because most of the time men are afraid that they'll be, they'll have a response of like, what in the world do you know about this? Like that's number one. And nobody wants to hear that from anybody, especially when they're coming from a place of deep care and just wanting you to live your best life and all that stuff. So that's why it's kind of the best if you can just, you know, resist, well, give in to the let go of the resistance if you feel like, oh, this is not my place to be here, and just use this as a tool. Hey, look, she's a woman and she says painful periods are not supposed to be painful. And menopause is not supposed to be this crazy. Maybe let's have a look and see if this is real. Number one. So that's the number one thing I want to say for the men out there. And as well to the caregivers, what I have to say on this is very simple. The fact is, most of my clients are in healthcare. They work in it, whether it's privately or publicly, and they found me because they didn't feel like pain popping medication was the right way. And that intuition led them to me, and I showed them that there was another way. And because most of them, if you're listening to this and you're one of them, you work so hard and you don't need a few days of your month to be excruciating, like end of sentence, period. So let's go from there. You don't have to waste a few days of your month every week or be super stressed about not knowing how this month's gonna go.
Yeah.
It's all gonna end.
Absolutely.
That's
Thank
right.
you so much for that. And as far as
Mhm.
the stress about how this month is going to go in
Yeah.
periods affecting caregiving, I have had to have my son, who was 12 at the time, or 11 or 12 at the time, make dinner for my family because I was in so much
Ooh,
pain. I had lost so much blood.
wow.
I was lightheaded. I was nauseous. We actually missed appointments because I was dizzy and couldn't drive from period symptoms. Like I could not, like I
That's
didn't feel
right.
comfortable getting behind the wheel because I
That's right.
felt like I could pass out or faint. I just needed to
Mm,
sit down or lay down. And I had to have my older son help with dinner. And I sat in the kitchen and I was
yeah.
like, okay, bud, like we just did beans and hot dogs because that was an easy thing for him to make.
Aw.
And I said, okay, we're going to cut up the hot dogs. We're going to put them in the pot. Now let's open the can of beans. It's a filling meal for everybody, and beans are
Yes.
great with iron and protein. So but it was like, but with and not even knowing yet that I had a severe iron deficiency on top of it, but like
Mm,
that feeling of I'm gonna faint. I have to take care of this person and I can barely take care of myself, and having to deal
yeah.
with that every single month
Mm.
was horrific for me and it was difficult for my family.
Thank you for sharing that number one, because like that story is just the beginning. Because man, yeah. And then there is also, I mean, the fact that he was 12, and he was cooking. Oh my goodness. What I see as well is that women are also when I see people with endometriosis or PCOS, for example, I'm also seeing people who are having that every single day, and they can't wait until they can finally get that surgery date to remove everything, you know? And I'm telling you, that's not what has to happen. There's something deeper going on, and we can absolutely address it. And first two things we need to address, which is amazing because you kind of mentioned some of it already. You mentioned iron deficiency, right? The first two things that I the first two things that I always make sure are covered for these women are number one, their nutrients. Number two, their detoxification systems. So both of these have to be working well, be online, and properly nourished. So let's start there, shall we? Let's start with nourishment. Yeah.
Let's
So nourishment, nutrients, there's two categories that I focus on, macronutrients and micronutrients. Macronutrients are what you think of food as being. Think of your protein, your carbs, your fat. Number one place I start, I make sure you're eating enough protein. And like side note, not just any protein. You can't you can't get this through the you can, but it's really bad. So what I'm saying here is like you can't really get this through the vegan or vegetarian options as well as you can from the animal options. Many of my clients are recovering vegans and or have dabbled in vegetarianism for a long time and seen everything kind of slowly decline. And there's a reason for that. And one of the reasons is that there are some amazing nutrients in animal protein that aren't there in the vegetarian options or vegan options. So number one, that's your macros, big level thinking. Macros, make sure you're getting enough protein. Are you having like a normal serving of protein every meal? Start there. It does amazing things, not just for that pain, but also for your mood. And I promise you, it only takes a few days to a few weeks for you to notice when you finally have enough protein. Why does it matter to have enough protein? Because it's what all your hormones are made out of. Most of them, in fact, and especially the ones that are related to your reproductive situation and your mood situation. So that's number one. Of course, you can't build a nice house, even if you have wonderful builders, master builders to build that house, if you just don't have enough resources to build them, right? Common sense. So, number one, get your protein, make sure it's animal based, once per meal at least, normal servings. See what happens. It's amazing. The other side of it, so we got the macros, and then we have micronutrients, and that's where things get very interesting. And that micronutrients has two categories. It's vitamins and minerals. And everybody knows there are vitamins and minerals, you know? But most people don't realize that they can't get enough of most of them from food alone unless, and this is a big unless, you're eating like your great great grandma. And I'm talking like liver pate every meal, like fresh cream and fresh milk from the cow, like daily. Oh my goodness, like those and all those things, incredible sources of nutrients. But today, what we're dealing with is mostly packaged foods, mostly not whole. And packaged and processed is very different in my world, but that's a whole other sidetrack. But overall, vitamins and minerals, there's not enough of it in our food today. So what happens? Your body prioritizes and doesn't make enough of the non-essential hormones, which means what? Which means that your non-essential activities like reproduction just sort of fall to the side. Okay, we'll just throw them resources when we have some scraps to throw them. And what we'll focus on instead is breathing, thinking, walking. Okay. Because that's amazing. Your body should do that. That's so smart. Okay. So macros and micros, I always make sure that they get their vitamins A, D, and K. Those are the big fat soluble vitamins. They're incredible if you take them together. And again, just like the protein, the differences are noticeable within a few days. Um, and if you're super deficient, it's very weird. Either you notice it immediately because you've been so starved of it right away, or like it takes a few months because you're so starved of it that your body's like, we're gonna use this right away over here and here and here. So it's very different for how people react, but I promise you start with an ADK and don't start with like, and of course we're going to make sure your dosing is high enough because most of the doses out there are not sufficient enough at all. Um, but yeah, and then so that's the ADK. And let's just throw in the dosing. Why? Why not? So I always begin at least with 5,000 international units of vitamin D3. And then we got vitamin A. We want the retinol type, which is the animal form, by the way. And this will be a theme throughout my entire approach here. Most of these things are only found in animal foods. Very interesting. Okay, now vitamin A. So we want the animal type, and we want at least 5,000 international units of that as well. And then lastly, we have vitamin K2. So K2, we want at least 250 micrograms. That's mcg, not micrograms. We have these three, and the reason you want to take them together is that they work synergistically. So it's like 1 plus 1 plus 1 does not equal 3, it equals 10 because they work so amazingly together. So those are your vitamins. That's what I always make sure my clients have right away. And differences are beautiful when you get enough in your body. Again, it depends on your size, what you do for a living, and like your activity level too, like of how much of these nutrients you need day to day. And that's where things should be personalized for you. And then we have the minerals. My goodness, we're just moving through this so quickly. I love it.
No, it's great though, because this is super important information and
That's right.
getting and also like understanding too what vitamin supplements to take. A lot of people will promote supplement packages that has a lot of things that maybe you don't necessarily need.
Ooh, yeah.
Versus, a lot of them have just preserve there's some supplements, if you read, they're like loaded with preservatives and stuff, and it's like, do you really need this? Is this really the healthiest option? Do you really need this much of this supplement, and it doesn't have these other supplements like the vitamin K in
Yeah.
it and stuff. So I think it's important to get this information. And I am a huge advocate for, if you are going to take vitamins, you're buying
Mm,
it from the bottle of the specific vitamin, and you're getting the what you need and what you're deficient in,
yeah.
um, versus just going and buying the multivitamins and things.
Thank you for saying that. My goodness. That is like with the like number one spot I begin with, especially not only with my pain clients, but my infertility clients. Like it's not a multivitamin, a prenatal, you know? Um most of them aren't that good, and you need specifics. And my goodness, we just had a situation before the call started where we came across a drink where it was like they just sprinkled in a bunch of vitamins into the drink, and like we figured out that one of the B6s in the drink was the form that's like super crappy. Like it's the form that it's PHCl, I think it's for the short form, but it's basically the most common form of B6 that people add, or manufacturers, producers add to their product. And like it's really bad news. It's like the form that sticks to the B6 receptors in your body and then like stays there for 2 years, making them unusable. And one of the things that comes from that is peripheral neuropathy. Like it's bad news. So like we really, you know, everything has a context. Just because it has vitamins in it added, especially, it's not necessarily the bee's knees, you know? Wasn't that interesting that just happened? I thought that was just such serendipity for our conversation.
Yes, absolutely.
Amazing.
And I know we were getting on minerals a bit. So let's talk about like for
Yes.
for that time of month, what minerals
Mhm.
should me and everyone else be making sure we're getting into our body and how?
Let's do it. My favorite. Okay, so minerals. Let's start here. Okay, now there are the first thing I want to do with minerals is get them in your water. And the second thing I want to do is get them through food first. So I find a really good high quality liver, heart, and organ, let's see, liver, heart, and kidney supplement, either all combined or separate. And there you go. Now that's your multivitamin. What's that? That's those are the three biggest organs in most mammals' bodies, and they have the most concentrated, most the right forms, most bioavailable forms of most of the vitamins you need day to day and minerals. And it's just incredible how that works. And I mean, I know both of us really like we really find it intuitive that we should get everything from our food. But because we have so much packaging in our food, we know it's not possible. And because our soil is so depleted, we know it's much harder today than it ever was. So the fact that we can get an encapsulated form of these organs into our life, that's amazing. So again, that's food. That's actual food. People used to cook with organs, beef, liver, heart, make pies, make a side dish, make the main dish. It used to be a thing. It's not a thing right now, and maybe it will come back. That's my hope. But even most of the time, I'm relying on those capsules to get most of my doses. And the thing I really want to emphasize here, is the value of taking it from food, especially minerals, is that minerals are such a game. They are such a game. That's just like how I want to summarize it. Like, if you don't take one in the right ratio with another, you throw the whole body out of whack. So, like, like when I went to school with this, that was like the most amazing thing I ever learned, among many other things. But most people are like, okay, I don't really care. Just tell me what to do. So just take the beef organ supplements. Find a combination, find a really good source. Grass-fed, grass-finished cows, that matters. If it eats grains, it's not the same mineral content, unfortunately. So that's just the result. If the cows eat grass, you get the right mineral content. It's amazing. So those things matter. Start there. Tell us how amazing you feel because you will feel so, so much better. My journey personally started with deep depression, not only period pain, like severe period pain, but it started with depression. And I find that the the minerals we talked about and the vitamin protocol we talked about, those things literally saved my life. So if anybody here is dealing with depression, like serious, you're going down the road of suicide pacts and so on, try this because I promise you, the way you're seeing the world right now, if you are feeling occasionally depressed or you are right now, the way you're seeing the world right now is like seeing the world with smoke. You're not you're not seeing the fire itself, you're just seeing all the smoke. And I promise you the smoke will go away once you're nourished enough. It's just like clockwork. I haven't seen that go wrong ever. So that's a little side note. But now we have the two things, my two approaches here. If we go back to the big picture, I talked about nourishment. Now we've talked about your macros and micros. And then the other thing I always focus on is their detoxification system. We want that well functioning and running smoothly. And funnily enough, the number one way to get your detox system on board is to make sure you have enough nourishment. Isn't that beautiful? Like, like even before you do detoxes, and there's so many out there. There's parasites, there's candida, there's liver ones, kidney ones. If anybody wants you to do a detox and they're not even making sure you're well nourished first, turn around, go the other way. That is just a gimmick. That's not a long-term fix, okay? You gotta have someone be telling you, hey, you gotta focus on your foundations first. And that is vitamins, minerals, and your macros, okay? Um, so heed that advice. 10 years of making these sorts of mistakes, thousands of dollars wasted personally. I hope you just take that advice and never waste that money or time like I did, and many of my other clients have. So number one, that's detoxification. That's the very first thing I do with detoxification. And usually at this point, most of my clients are feeling way better. And when I work with detoxification, the next step is to make sure that they're having enough water run through their body. Your body, your blood is like a river. And if can you imagine a city that has a really slow, murky river flowing by it versus a city that has like a nice, full, healthy flowing river going by it? Which city are you? Your blood is either the murky, slow, stinky river or the healthy, nice, fresh flowing river situation. Okay. How do we get there? We drink at least adequate amount of water. Adequate is a very intentional word because because everybody's so different. Everybody really is so different. And I find that the safest way to start is a liter for most people. I believe in American speech that is 32 ounces. Is that right? Or wait,
Oh
double
gosh,
that.
I don't know
64?
the conversion.
You guys are smart and resourceful. I'm sure you can figure it out. 1 liter, right? So, that's it. Start
I'm
there.
looking up how many ounces in a liter.
Yeah, exactly. Thank you. So we've got Sarah on that, but meanwhile, sh start there. Um, Ideally, let's see if we get it filtered. Let's just start there. Depending on the country you're in, we have different laws about what cities are allowed to do with our water. And the situation is not that great unless you live in Western Europe. And even then, it's still a little icky. So we've got everything from old pipes to reused river water situations, and that lots of that stuff is problematic, as you can imagine. And we just don't need that in the water, right? So instead of tap water, always just see if you can do that extra little step and get filtered. Um, I like to start with Berkey water systems. It works great. Um, you can basically pour mud into there and get water on the other side. It's like that nice. Um, and other than that, spring water. Check out the springs around town. There's an amazing website called findaspring.com. Um, See if somebody's tested the source, if there's any dangerous things, anything dangerous in it. Usually there's nothing wrong with it. It tastes amazing. It'll be the most amazing water you ever tasted, okay? I promise you that. So that's it, but always do your due diligence. Test it. Test it so you know, and then move forward. Start with the filter if you're not sure. That's just the easiest way to go. I love making things easy because honestly, this whole thing really is easy.
Yeah,
Now,
absolutely.
that's a lot, Sarah. What do you think?
I think I no, but that's good information. And
Mm.
again, this is solution based with these heavy period issues. And of course, call your doctor. And if your
Oh,
doctor
yeah.
recommends surgery, like get the surgery.
Mm.
If also I want to say 1 liter is 33.814, so 34 fluid ounces roughly.
My goodness. Thank you.
So so we have that information now. But no, definitely like again, like you're talking about depression and stuff. If you're in like a deep
Yeah,
depression, like an emergency state,
that's right.
call 988 in the US, which is the suicide hotline.
That's
But
right.
while you're going through your therapy and you're doing your meds and stuff, you can make
Yeah,
these changes.
that's
In
right.
addition, this is not a one or the other. Um,
Yes.
this is combined together, and it's super important that people get that point across. And I just want to talk about like pain reduction in our periods. There's nothing wrong with taking Tylenol either if you need it. Like if that's what you got to do to get through the day, in addition to making
Mm,
changes,
mm.
got to do what you got to do. I can tell you that my pain was so intense, I would be sitting on the chair crying. Like I
Oh
could not stand up. It would
my
radiate down
gosh.
into my leg. I could feel it. I could feel
Yeah.
cramps into my kneecap and almost up into my mid back.
Yeah.
And
Yeah.
I remember my husband, actually the reason I went to the doctor finally, because I thought that this was just my mother suffered from this, my grandmother suffered from this.
Right. Yeah.
Um and I was just under the impression that this was what was supposed to happen. I can even remember an elderly relative telling me this is what we get for eating the apple in the Garden of Eden, and I'm like,
Oh my goodness.
I don't know about that, but okay. And I just and that's what they were told,
That's right.
they weren't told that this wasn't normal. It was,
Yeah.
this is punishment for what, 2000 years ago, like, or more,
Right.
like 10,000 years ago, one woman made a horrible mistake, every woman must
Yeah.
suffer. Like, no, that's not fair, and we're not willing to accept that anymore. um
That's right.
but it was my husband, and this is why, again, I think men should listen. It was my husband saying to me, hey, my mom, my sister never like did like this. I never witnessed this with them.
That's
Granted,
right.
his family didn't talk about this, but he's like, I don't remember my mom feeling like she was, saying she couldn't take care of us because she thought she was going to faint. I don't remember
Mm.
my mom not being able to stand up because cramps were radiating down her leg and crying. He's like, and if
Oh,
you don't go to the doctor, I'm not getting you Chinese food next month. So there will
I
be
love that so much.
there will be no chicken wings. There will be no beef teriyaki. Like
Mm.
if you don't call your doctor, you're not getting Chinese food next month, you know,
That's
um,
right.
which was kind of cruel of him, but also it was the motivation I needed.
That's right. Good for him, honestly. Good for him. That's, I know that was hard. I honestly, of course, that's hard for you, but like, hey, yeah, you're not crying on that chair anymore, are you?
No, I'm not. Well, I'm still having issues on and off, but not as bad.
Okay.
But
Okay.
I did have the ablation, and that's how they found the
Yes.
iron deficiency. In
Yes.
addition to that, they were like, hey, you shouldn't be feeling like you're going to faint. We need to do
Mm.
blood work. Um, and unfortunately, that did not correct the deficiency. And that's another thing, actually, I want to talk about,
Oh yeah.
with deficiencies and stuff like that. If you're in supplements, because unfortunately, when I take iron, I have a systemic reaction to it,
Yeah. Yeah.
despite me being deficient in it. So, I actually, and this is important for the audience to hear too. Be careful.
Yeah.
If you have these types of reactions, like, stop taking the supplement,
Yeah.
because obviously you could be putting yourself in an unsafe situation.
That's right.
I would take the iron, and not even an hour later, my face is beet red. I'm hot. I'm starting to sweat. My chest
Ooh.
is red, and not to be gross, guys, but vomiting and diarrhea, like
That's
massive
right.
stomach cramps, vomiting and diarrhea. And when I go for the infusions, I have to have IV Benadryl and an IV Pepsid, because those both work as antihistamines in addition to the iron, because otherwise I blow up like a balloon,
Yeah.
and my face and my hands and everything swell up like 3 times the size of what it normally is, which is dangerous. So what
Mm.
do we do in those circumstances?
Yes, allergies are super important to talk over. So, just very briefly for everybody, what is an allergic response? What does it look like? Okay, it looks like redness, swelling, mouth tingling, that sort of thing. Um, this is really important to pay attention to. I have had women before that had that reaction to regular iron, and usually, I know. Both of them had, um, both of them reacted very well to taking liver organs instead. And what is that? It just has a whole bunch of iron in it that's very bioavailable. It's a different form of iron from the one that we take if we go to the drugstore. So number one, that always worked for my clients. So I'd start there. But again, notice the allergy symptoms. They're very, very important to keep attention to. Along that line from what you started with, working with doctors, oh my goodness, so important. And of course, I actually love starting that way because I always work with my clients' doctors. If they have anybody that they're working with, it's super easy for us to chat together. Um, all you got to tell them is like, hey, I'm working with this nutritional therapy practitioner and we want to make some changes. Could you help us like look at the situation while we're doing the changes? And almost nobody says no. There was like one doctor who was like super stubborn, like, but I've never had any bad, doctors say like, no way, don't you dare.
Yep.
In that situation, we just fired him and she found a new GP. But but so number one, absolutely, working with doctors is like the best, and we love doing that. And notice your allergy symptoms. And as for I just wanted to mention too, like I love how you brought up Eve because we Eve bit that apple and then we said it was said that we're supposed to have experienced painful births in particular, I believe. I don't think it said periods, but I think we can pretty much say it's both. Because honestly, that's what I think. I've always said that from day one. That's probably why. So, but that can be an excuse too, like relying on those stories to justify this pain. Because I think the other thing that I say to people all the time that turns heads like crazy is not only just that painful periods, painful births, painful um, menopause is not normal. I also say painful womanhood is not normal in general. Okay, let's just start there. See how you feel about that. And all the things that come up. There's so much underneath that we have to dig up for a lot of people. And the place where I like to start with above all is just ask yourself this. When is it ever normal for someone to have regular pain in their life and it doesn't have a chronic disease label? All right, let's just let that sit. I don't think you have any answers coming up. And that's because it's not normal. And I promise you, it's not normal. I just really feel it. It's from a deep emotional place for me. It was so amazing the first time for me when it happened and it wasn't painful. Man. And I didn't need to take drugs. Man, it was incredible. And it was so I don't know, self I don't know, satisfying somehow to know that your body is enough. Like you don't ever need to experience pain throughout your life. Like you don't really, nobody really says this, but it's important to say you don't deserve chronic pain. Like you don't need to be punished for anything. You didn't do anything wrong. People just don't know how to properly nourish themselves. That's it. That's the majority of the people I see. And just another little point on this period pain is that we do have a name for painful periods, and it's actually there's a few different words for it. And you mentioned that you had an ablation, right? And most people that have that are usually going in for like more surgeries because of endometriosis condition. So there are words, guys. There is PMDD, look it up. There is endometriosis, PCOS. You might not have all of these things or even any of these, but in my experience, when you do have period pain, you're on the track to one of those three or something else. That's my clinical experience. So just pay attention. The other thing I want to say about pain is that it's a message. And most of my work is teaching people how to read their bodies again. Your body has a language. One of them is pain. So let's listen to it, okay? It's not normal. It's a symptom or a sign, okay?
Awesome. Thank you so
Yeah.
much for that. And do you mind telling us like what exactly or what signs are other than,
Hmm.
feeling like you're going to pass out, and being in so much pain you can't stand up? Because that's I think almost everyone would agree that okay, that's probably beyond even
Yeah.
what a basic normal would be. What other
Yes.
symptoms and signs are really like beyond normal?
Yeah.
For the dads taking care of daughters or husbands taking care of wives, what should they be looking for?
Yes, absolutely. You should be looking for, okay, so sometimes it's quite varied, so brace yourselves. Okay, but where I like to start with this is what's not normal is that you can't go throughout your day and walk around without feeling like you will, like, you just can't. You're completely unwilling to walk. Like that's actually not at the edge, like the worst of the worst. It's like right at the edge where like something's starting to go wrong. You should be able to walk without feeling like it's unbearable, okay? That's where I like to start. Sometimes it's very specific pain. It's like on the right side of your ovaries or your left side of your ovaries. Sometimes it's referred pain, and the ovary part is like throughout the month, usually around ovulation, for example, not during your menstruation or when you're actually bleeding. So that's a very specific point, and not everybody would know this, right? So um, all the other pain that happens outside the menstruation can look just like the pain that happens during menstruation. That's abnormal. Okay. So then let's go back to menstruation pain and see and explain what that is. Okay. And if it's happening at any other point outside of menstruation, now you know it's also no bueno. Okay. So we've got, you can't focus on anything else. Um, it's like there's so much pain, you can't even numb yourself out using television, you know, which a lot of us do if we're lucky enough to take time off work. We are referred back pain is a really, really common one. So like you can't even stand straight, you just want to bend over, you're curled up, you lean over a chair or anything you can if you're like up and going. And then we've got a lot of like you can't be comfortable in any position. Like no amount of warmth comforts you enough. You're on your side, but you feel bloated, so you move to the other side. You're on your stomach, but that's too much pressure. You're on your back, but like then your stomach naturally pushes in from gravity. Like nothing feels good enough. It's very much like that. So you can't find a comfortable position. And what I also want to point out too is that darker thoughts, simple stuff, things are pointless. There's no hope. Continuous thought loops of negative events that have nothing to do with your present moment, like lots of that sort of stuff will come up. And that's actually something that might also pop up like a week or two before your menstruation as well. So like all those things are also signs that, hey, your hormones need support because they're like barely getting enough resources to do their jobs, which is to keep you optimistic and hopeful for the future. It's not like we don't have hard times, but like people can have a hard times and still feel like they have a chance, you know? As
Yeah.
there's a difference between that and feeling hopeless and having a challenging time. Okay. So that's where I like to begin with the pain. There's probably lots of stuff I didn't mention because there really is a lot. But I think especially for the dads out there, or the boyfriends or the husbands, I would like to say that, or the sons even, honestly. I've had a son help his mom like this. So, um, cravings. So particular cravings, especially around a week before your period, those are signs. Your body is basically trying to get you to eat specific foods for specific nutrients. Um, Lots of those things. But surprise, surprise, most of those go away when you nourish yourself properly. Like all of this connects so beautifully. And I do want to mention one thing too, is that it's not spoken of enough the consequences of not addressing this period pain in the long term. Most people like you and me, we had a similar situation. We had to have someone, force us to look at what was happening because we were so dysfunctional in our life all of a sudden, right? Okay, so most women, we just ignore the pain because we think we can deal with it about once a month. That's fine. Or we can pop painkillers, right? And I just want to, I'm gonna be that person, and I'm gonna be the one that says, okay, you know what? Later on, it develops into something much worse. It's just, I feel a lot of emotions with this because it's so powerful. I've worked with people that have already done the surgeries and already went through decades of pain. And I just wish, I could have reached them before they went through that. Because anyway, it developed it into something much worse. So, and those surgeries are not cheap, guys, okay? So having your whole, you know, anything from your tubes to your uterus, etc., removed, that's a lot of money. Depending on the country you're in, that's 10, 20 or more grand. And on the way there, if you're having anything like excruciating pain, where you get smaller surgeries for it to remove excess tissue that has overgrown, those are also a few grand each. And for most people, when they have those surgeries, the majority of them, I believe it's more than 60%, what I looked at the numbers last time, more than 60% have all their symptoms and pain come back within 2 or 3 years. So guys, it's not, neither is it a solution to ignore this, and neither will it save you any time or money to ignore this, okay? Just take care of yourself now. It's so important. Yeah.
Absolutely. Well, thank you so much for that. And again, I know I can think of, I don't know, at least 30 women who have gone through, ablations or have had to have full hysterectomies or went through that whole process.
Yeah.
Because this, and obviously if there's medical treatment for it, it's not normal.
Yeah.
Um, because the medical community would just say, yeah, whatever. But it's just, and then I know so many women who should have had surgery earlier and they just didn't because
Mhm.
they didn't know any better. And a lot of families, they don't talk about this stuff, and
That's
especially
right.
older generations, they don't want to have this discussion. But again, it's so important. And I want to kind of switch gears now
No
and
problem.
talk about menopause and
Yeah.
what the heck is normal menopause, because I I have no idea. And I'm a woman, and I don't know too many women who are, in their late 30s, early 40s, who know what's next, what's coming down the road for me.
Yes, absolutely. I just so much came to mind when you said that. Um, yeah, okay, so there's lots of things that we think is normal when it comes to menopause, and that includes having it super early. So there is something called like early on or peri, and then there's menopause, and then there's postmenopause. That just means before or semi, and then there's after post, right? Okay, so here's what people think is normal, but isn't. Night sweats, hot flashes, similar. Um, Dryness, especially in the vaginal canal. Um, Irregular periods, a little more normal. That's about the only thing that's more normal. Because why? You're just your body's slowly releasing less eggs because it just doesn't, it's running out, because we only have so many eggs as a woman. So what else is not normal? Again, with the night sweats is super hard time sleeping, okay? Real bad. Um, super severe mood changes. It doesn't matter if it's like in the anger zone of mood, like really triggered very quickly, or in the zone of like mellow and depressed. Doesn't matter. It's both ranges. Um, and then we also have a sense of like everything slowing down, some people losing their hair, weight loss, I mean weight gain and that sort of thing. So that's just some of it. But I think when you talk to anybody who's in menopause um, and doesn't know how to take care of themselves, um, they'll also say things like, I just feel crazy. Okay. I feel crazy. My body feels out of control and I feel crazy. And why do they say that? It's because they feel like their mood is all over the place. And it's because they're not getting enough sleep. And it's because the temperature of their body is also fluctuating like crazy, like never before. So that's why they feel crazy. They're out of control, so to speak. Now, as a nutritional therapy practitioner, um, even before I was a nutritional therapy practitioner, I grew up in Europe. And in Europe, I was surrounded by a culture where women in their menopause years didn't have a hard time. And it's not like they didn't have a hard time because they didn't talk about it. They didn't have a hard time because they didn't have a hard time. Like they enjoyed themselves more than ever. Like less periods, fantastic, Like, and they were content, feeling good in their bodies. Bodies felt better than ever. Like all of that, this sort of I call it like the North American kind of standard diet menopause is really what it is. That's a new thing, okay? So let's start there. It's a new thing. So even before I studied this, it wasn't normal. And after I studied this and figured out I found the functional reasons for why this happens, um, it's even more crazy that we think all this is normal. So what's going on? It's all hormonal, okay? And for most women, and it depends on the person, but what changes your hormones fundamentally is either toxicity or stress or anti-nutrients or lack of nutrients. Okay, so we already talked about nutrients. We haven't talked about anti-nutrients, but just short list. For some people, it's oxalates. Some people, it's lectins. Um, one lectin, for example, is gluten, but it's just one lectin, right? We're not just picking on gluten. Oxalates, one example of oxalate is, it's very high in tomatoes. It's just random vegetables, that are high in them. Okay, so that's anti-nutrients. Sometimes it's that throws your hormones off. And then sometimes it's stress. Stress is energy demanding. So if your body is wasting resources on making stress hormones, then of course it's not going to make the essential hormones that you need to feel good and transition really well. Okay, and the last thing I believe, so we talked about nutrients, stress, and what was the other thing? Yeah, detoxification. So again, your liver does a lot of the hormonal conversion job. So anything that it has to do with your hormones, your liver kind of like directs it like a king or a queen, okay? Now, if it is like bogged down with already lots of toxicity in your life, and I don't mean like negative people. I mean like car exhausts. You know, just living in the modern world, honest, that's just how it goes. So, um, those three throw off the hormones. And we learned something about very specific cascade in school, for example, and it's called the hormonal cascade, and it goes like this. So we've got the adrenal glands, and then we've got and if they go off, so if they go unbalanced, and they give up, they give all their responsibility to the pituitary gland. Okay, now the pituitary gland has much harder time. And now it gives up. Okay, what else gives? It just keeps going and going and going until it reaches your thyroid. And when your thyroid gives up, your sex hormones also get messed up. And when we reach the sex hormones being messed up and your thyroid, that's when we get the temperature fluctuations. That's where we get the vaginal dryness. That's where we get the crazy moods. Like, it all makes sense. It's just one system at a time. It's just giving up because it's running out of resources or it's stressed out. And that's the simplest way I explain it. Um, and yeah, it could be a whole episode for in itself. But yeah, I think that's a really good place to start. Just, I want you to know if you're going through it right now, take this message with you. You are most likely not broken. All your systems are most likely perfect. The only thing that's quote unquote wrong is that it just doesn't have enough resources to do its job. So, of course, it will look like it's broken, but it's just, running on fumes. Okay? You could have a Lamborghini. If you don't give it gas, it won't work. Okay?
Yep. I like that. Thank you so much for sharing that.
Yeah. And there's
I
so
know
much more, right, Sarah? Like,
there is, and
yeah,
there's so much to it, and it's these are topics that they're either not discussed, they're
yeah,
definitely taboo. And women are going through, especially menopausal women, they're going through these major changes
yeah.
while taking care of someone else. And yeah,
Oh
it
my
can, and
goodness.
just the stress of being a caregiver can make you feel
Yeah.
like you're going crazy before
Yes.
before PMS, before menopause, before whatever, just that stress is enough to kill you. Um, and, and then you add everything else in on top of it, and it's like, oof. But again,
Mm,
I think it's important. And um, I know we talked a bit about what signs are not normal in menopause. Again, the dark thoughts,
yeah,
the hair loss and things like that. Again,
yeah,
and I say, even I don't care what condition, if you're having dark thoughts, you're really depressed, or you're
yeah,
having major mood swings,
yeah.
even don't just attribute it to the change. Get counseling, get counseling, see a psychiatrist as well, because there could be other things going on that haven't been discovered. And also, it never hurts to talk to somebody. um it can actually help reduce your stress levels, which can help overall also, right?
I love that. I love
um
that.
I
That's right.
I'm a big fan of my counseling sessions. I highly recommend. I'm one of those people who believes everyone should be in therapy, though, especially if you're a family caregiver.
Oh,
um
yes.
Taking that time for yourself is important. I know we're kind of running out of time, and I appreciate all the information that you've given me. I want to wrap up to my final two questions.
Yeah.
And the first one, this is my favorite question to ask all my guests. What is your favorite form of self-care?
Oh, yes. Um, my favorite form of self-care. Okay, let's see. I actually have been doing a lot of work in this area recently. So, and maybe I don't mean work, I mean play. And I think the first thing I did, which I think I need to just say is probably my favorite because it made all the difference, is that I made time for myself first. And I mean like time and money. I put aside both of those and just said, okay, I just want this amount set aside for me, this time just for me. That's where I started. And I think so much relief came from that. And it was just, even without even doing it, that really came. Um, that was wonderful. It was totally free too. Like I just had to say, okay, well, this time at this day, that's just me. I don't have plans, or I have this thing I want to do, and this is, I put aside the money for it, and like that's it. Like I used to just keep going and going and going, and like That's never a good idea. You have to, so that's my favorite form of self-care. It's to keep your promises to yourself. That's
I like that.
basically what I did. Yeah.
I like that a lot.
Don't lie to yourself.
I really like that. I
Yeah.
always like it when I have something to look forward to that I'm gonna,
Oh,
even
yes.
if it's something that I'm doing with the family, or you know what I
Yeah.
mean? But I just like having something to look forward to. And
Mm.
that always helps my mood. And I think that that kind of, you know, like you said, just making that plan, I think that that's right
Yeah.
in line with that. And it's accessible. We can all make a plan that we look forward to, that we know we're going to keep. And you know, I I think that's great. And then my final
A
question.
side note, if I can, Sarah, like, not only does it, the reason it makes you feel good, I just found out as I practice, is because it actually triggers a hormonal cascade in your brain. When you take one moment in the shower, for example, in the day, and you look forward to something that's happening later on, whether it's today or later week or later in the month, it really makes some happy, content hormones. It really does. Like it's as if it's happening now, like almost as good. So like it's a real trick, and guys, it's free.
Yeah, absolutely.
Yeah, I
Absolutely.
love that, Sarah. Nice.
And my final question, where can my audience find you for more information?
Yeah, no problem. It's really easy. I work with clients one-on-one, and you can book a free consult call with me on my website. It's on isabellathor.com. Yes, just like the god, the amazing god Thor. I'm from Iceland. I legitimately can claim this name, okay? My father's name is Thorstein, so that's basically Thor. So okay, Thor. Book a call with me there. We'll um discuss your exact goals, and I'll tell you how I'll help you get there.
Awesome.
That's how it
Thank you
works.
so much. Thank you so much, Isabella. And thank you to everyone who listened this week. For more information, again, Isabella's website will be in our show notes if you'd like to reach out to her or find her there. If you liked what you heard, I recommend that you share the show with a friend. If you feel like the information could help multiple of your friends, please share it with them. Um, if you want to support the show, there's links on our website, Stelmach Brand Media, where you can donate to the show, support the show, become a sponsor. Um, Also, we ask, you know, if you can't do that monetarily, share our show with all your friends. Thank you so much, and we'll see you next week.